Good evening, everyone. Thank you for joining us. While we wait for everyone to pile in here, we wanted to just give you a few housekeeping items. And so we will definitely be recording this. We're live streaming this on Facebook, and we are recording as well. We are also wanting to hear from you. So we will have a Q&A section at the end. And so please enter in your questions into the chat, and we will get to those a little bit later. Those who are joining on Facebook, you can enter in your questions into the comment chat, and we will be sure to get those as well. But I wanted again to say thank you for joining What's at Stake for Healthcare Coverage in New Jersey. This is there will be a lot of important information shared today from some really great speakers. And but before I get into all of that, I did want to truly thank our sponsors. Our co-sponsors for tonight are the American Cancer Society, Cancer Action Network, and in particular, Quentin Law, the Government Relations Director. I don't know, I think Quentin's on. I don't know if you'd like to say a few words. You certainly can.
Thank you, Laura. I just wanted to say thank you. This is such an essential conversation, especially when it comes to those here in New Jersey that are fighting cancer, because Medicaid provides access to life-saving care for people that are fighting this disease, and especially low-income individuals, primarily from rural and underserved communities. And we know 1 in 10 individuals with a history of cancer rely on Medicaid. 1 in 3 children diagnosed with cancer are enrolled in Medicaid at the time of their diagnosis, and we need to increase access because that increases survival rates, reduce costs, and improves outcomes. So thank you for allowing us the opportunity tonight, and I look forward to the conversation.
Thank you, Quentin, and thanks again to the American Cancer Society Cancer Action Network. And our other co-sponsor that we would like to also sincerely thank is the New Jersey Black Empowerment Coalition, and in particular, Jane Collins Golding, the chair and co-founder. And Jane, please, if you would like to say a few words, please do. Oh, is Jane? Did I get her? Did I lose her?
Yeah, I'm here. Can you hear me?
I can now.
Okay, good. Thank you. The New Jersey Black Empowerment Coalition is a statewide nonprofit organization at the intersection of policy, democracy, and civic participation, working towards justice in New Jersey. Our goal is to educate the broader public about issues they're facing in New Jersey. We have incredible wealth gaps, criminal justice, educational opportunity, housing, and healthcare, and many other areas. So tonight, I'm really happy that we've partnered to talk about what's at stake in New Jersey with our healthcare. So thank you for having me, and I look forward to, and anybody else who's on tonight, tag your friends, tag your family members, and tell them to come on. Thank you so much for having me.
Thanks again, Jane. Thank you. And that's right. This is definitely the place to be on this night, and to hear exactly what's happening with healthcare coverage options, what's at stake for federal funding of New Jersey FamilyCare, Medicare, ACA, health plans, and any possible changes to eligibility. So without further ado, let's get into it. For those of you who might be new to us, New Jersey Citizen Action, We are a advocacy and direct service organization. Here on the screen, you'll see our direct services from free tax preparation all the way through free healthcare enrollment assistance. And our advocacy spans from healthcare, workplace justice, government, good government, consumer protection, and financial justice, election work, and auto discrimination work. So we try to do a lot for the folks of our state and our nation. So what's exactly happening? I know so many people are seeing so many headlines about healthcare and what's coming out of Congress and Washington and the House and the Senate and all of these things. And so we really wanted to kind of get into the who, what, where, whys, and hows of it tonight. And so basically, our Congress in Washington has created a budget, is crafting its fiscal year 2026 budget that it would like to pass. And what's causing all of the concern are many of the provisions that are in this proposed budget that's working its way through both sides, the House and Senate, as we speak. And a lot of what we are seeing is why we are concerned is that there's a lot of cuts coming, being proposed to healthcare. And the reason for these cuts is really to pay for tax breaks for wealthier corporations and billionaire wealthy people. And so this is essentially taking from the least and giving to those with the most. So to be a little bit more specific, in the House has passed its idea of a budget reconciliation package. And that included $900 billion in cuts to healthcare. That includes Medicaid, Medicare, and ACA plan coverage. And from those, that $900 billion, 15 million people could lose coverage. There's also $330 billion in cuts to education and $230 billion in cuts to SNAP. And SNAP is our food stamps, folks who get food stamp benefits. So to kind of bring it down even more and just kind of explain. So in New Jersey FamilyCare is our Medicaid program. It has 1.8 million people enrolled in New Jersey FamilyCare of all ages, from newborn through actually there are some seniors. Our seniors enrolled in Medicaid as well. Medicaid is funded through what they call a formula FMAP. So that's Federal Medical Assistance Percentages. It's really the amount of federal funds that the federal government sends to states to pay for the state's Medicaid program, and then the state will then provide additional funds to make up for funding the entire program. And in New Jersey, we have kind of a 50-50 match and in some instances, even a 60% blended share match. And something else to note is that Medicaid is the largest source of federal funding for states just across the nation. So who's on Medicaid? Like we said, from the smallest of us to the oldest of us. So children, 1 in 3 children in New Jersey up to the age of 19 years old are on Medicaid. About 4 in 7 seniors in New Jersey nursing homes are on Medicaid. People with disabilities, 1 in 3 are working age adults, 1 in 7 are on Medicaid in New Jersey. So it really is a large program that spans many of our residents. So to get into the matching, as I mentioned a little bit earlier, just to note that when the government funds states Medicaid shares and costs, it's kind of broken out into a few buckets. So there's 90% that of costs are for what's called the expansion, ACA expansion population. So 90% funding of that population comes from the federal government. 65% of the cost of funding are low-income children and the Children's Health Insurance Program. 65% of that comes from Medicaid. And then, as I mentioned, 50% of the cost of most of the other New Jersey family care members comes from federal funding. So that's kind of a lot of a large portion of the Medicaid share comes from federal funds. And just kind of a note, New Jersey Family Care's budget is $24 billion. About 14 billion of that is federal, and about 10 billion of the remaining is from the state. So with the cuts that we are starting to see proposed from the House as well as the Senate, we're seeing that they're really focused in 3 areas. Reducing the matching funds, as we just kind of went over, also other funding streams, and also looking to change what Medicaid eligibility rules there are. And so for New Jersey, we are looking at about, or I should say at least, $3.6 billion less, a reduction in federal funds for New Jersey family care. This is a large amount of dollars, as we know. We also know that states who have expanded coverage to undocumented individuals are really paying a penalty under some of these proposed new provisions in the for what we're seeing in what's coming out of the House and the Senate. So for those who have expanded coverage, like New Jersey is very proud of our Cover All Kids program. We're very proud of that. We have almost 47,000 children who were otherwise ineligible for health enrollment coverage are covered in New Jersey. Because we have expanded, created that program and were able to expand coverage in that way. New Jersey is a penalty state, if you will, and it's proposed that there would be a 10% reduction in federal matching funds for Medicaid because of our expansion population. For our expansion population because of our expansion in Coverall Kids. So this really is looking like at least 350,000 New Jersey Family Care enrollees could become uninsured. That's a 1 in 5 or 20% of the folks on the rolls of New Jersey Family Care could lose their coverage. A little bit more about who and the population that were being targeted in New Jersey Family Care in this Medicaid expansion population. We're really talking about the folks who are making between 100% to 138% of the federal poverty level. So for a single person, that is between $1,300 and $1,800 per month of income. So that's the income range that qualifies under the Medicaid expansion population. So they are requiring now this population to pay $35 copays for doctor's visits. Typically, as you might know, they in Medicaid, there aren't very many requirements to have to pay copays. And so now if these the budget bill were to pass through Congress and the Senate, there would be an established criteria for copays now for that population of people. There's also work requirements, or they're calling it community engagement. And so this is requiring enrollees that fall within this Medicaid expansion population to either work at least 80 hours a month, do 80 hours of volunteer work, or be enrolled in school. There are some exemptions, and as I should note that there are two versions of the bill, of ideas of this bill at the moment in the House and the Senate. So there's some differences there, but there are some exemptions where now it looks like, especially in seeing some parts of the Senate, what the Senate put forth overnight, that there's no longer a blanket parental exemption. Now some parents could be included based on the age of their child. So I believe in the Senate bill right now, it's saying that parents with children ages 14 and over would be required to adhere to the work requirement provisions. And then there are some exemptions for pregnant women and people with disabilities. To what degrees, we're still trying to ascertain what those are in the new bill language. And just to give you a picture, for New Jersey, we have over 400,000 Medicaid enrollees who do not have children. So there would be over 400 people who would be required to adhere to these work requirements. So I also wanted to kind of go over some other changes, proposed changes to some of the services and other things within Medicaid. So there are proposed cuts to reproductive health. That's would be eliminating all funding for federal funding for Planned Parenthood, cutting all funding of abortion-related services, cutting funding for family planning services. There are cuts proposed to the minimum staffing requirements in our nursing home facilities. It cancels retroactive coverage beyond 30 days. So if you know of anyone or have ever been through, trying to perhaps say get re-enrolled or and there was some delays and your delay went beyond 30 days, your coverage would be restored retroactively. This would say that your coverage would not be restored beyond 30 days. So there would essentially be a period of time where you would be uninsured and responsible for the whatever medical costs there were out of pocket. There's a moratorium created on new provider taxes, and provider taxes fund state Medicaid programs. There's are provisions that ban Medicaid funding for gender affirming care. And they're also requiring more frequent eligibility reviews. So instead of um, instead of uh, going through eligibility redetermination processes every 12 months, they are requiring that these eligibility redeterminations go every 6 months. And if anyone's ever been through the application process before, at a minimum, it typically takes about 45 days. So, it's just uh, also adding to um, the speed in which folks would have to continue with their eligibility requirement reviews, but also is another opportunity for people to not meet a requirement there. So I'm going to pause a minute because I'd like to hear a personal story of how what's happening, how this really would impact one of our residents, Janelle Adams. She is a cancer survivor and a New Jersey FamilyCare Medicaid recipient. And we'd just like to hear from her, her personal story about how these cuts would impact her.
Hey, everybody. Good evening. Thank you for the opportunity to speak today. So the day I was diagnosed with stage 3 triple negative breast cancer, I also lost my dad. I was grieving and in shock. And then a social worker signed me up for Medicaid. That moment changed everything for me. Because before Medicaid, I spent over a year trying to get doctors to take my symptoms seriously, to give me mammograms. I was told I was too young. But once I was covered, the system finally started working for me. I received genetic testing, chemotherapy, immunotherapy, a double mastectomy, and I'm currently enrolled in a clinical trial, all without delay or impossible costs. Medicaid didn't just provide care, but it gave me stability and strength and the chance to be here with my daughter and my husband. Even now, it's my lifeline. Just last month, I went in to get my port flushed. A 30-minute procedure. Without Medicaid, it would cost $750. I've had 23 rounds of chemotherapy. And recently, now in a couple weeks, I am going to prepare to undergo reconstruction and get my port removed. These are all basic standard treatments for survivors. They're all at risk, right? but proposals in Congress could slash up to $793 billion from Medicaid. That threatens not just my care, but millions like kids, pregnant women, seniors, veterans, people with disabilities. When we talk about the cuts in Washington, we can't forget about people at home, the real people, the real New Jerseyans. Cuts mean delayed in treatments, crushing medical debt, and patients forced to go back to work when they're not ready. I'm calling on New Jersey congressional delegation to stand up for us and reject all cuts. This essential program. Doctors always talk about that 5-year milestone for cancer survivors, and I'm not there yet, but I want to be. And whether I get there depends in part on what you do next. So please don't make us fight one more battle just to keep our health care. Thank you. Thank you guys so much for this.
Thank you so much, Janelle. What a story. What a story. And keep up that fight.
Always.
Yeah. Let me continue. So we've heard about the cuts to Medicaid. We've heard how it can impact a patient. And now let's turn to how these cuts are not stopping with Medicaid. They're also cuts coming to the Affordable Care Act or Affordable Care Act Marketplace, or ACA Marketplace as well. And these are cuts that are coming from both the federal administration as well as Congress. So just a quick review. I know a lot of you probably know, but the ACA or Affordable Care Act plans, are health plans that people who do not have access to employer coverage or affordable coverage can go to our state exchange, GetCoveredNJ, and purchase health coverage on the exchange. We have over 513,000 residents enrolled in ACA or GetCoveredNJ plans, and most of them, 9 out of 10, receive financial assistance. So these are the folks that we're talking about. And the cuts that are being proposed coming out of Washington would nationally cause 5.1, at least, I should say, at least 5.1 million people to lose ACA coverage nationally. Because what they're doing is they are allowing for what's called enhanced premium tax credits. So these are ways in which people are ways in which our premiums, when we're buying them on the marketplace, are lowered and made more affordable. And so if you were to expire these subsidies, it would increase premiums. And so New Jersey would actually have about 500 million in tax credits end at the end of this year because of the decisions that those in Congress are making. And this is would cause in New Jersey about over $1,200 premium increase per person per year. This is like double the amount currently paid. And for a family of 4, the premium increase would be almost $4,200 more for that family. So this is really a big difference. This is really something to pay attention to, because all of the progress that has been made so far to lower the costs of purchasing healthcare and coverage on the ACA is beginning to be eroded should these decisions and policy changes be allowed to come to fruition. And just as a note, there are over 450,000 people in New Jersey whose health insurance would increase should this happen. So I also wanted to, unfortunately, list some additional ways in which it will be harder for people on the ACA marketplace. So there are also cuts to the enrollment period. It's really cutting it in half. So right now, we've been since the launch of our state exchange, we have had our enrollment period from November 1st through January 31st. So we had those 3 months, 90 days, and it would be cut in half should these changes come to pass. So it would no longer be 90 days, it would be 45 days for people to get enrolled. That's quite a difference, It would add more paperwork and more requirements to verify income when you're applying for ACA coverage. And so now you're having to fill out more paperwork, you have less time to apply. This is really will cause application issues and would prevent people from being able to enroll and access coverage. It's also removing eligibility for certain lawfully present immigrants. So currently, lawfully present immigrants are able to purchase coverage and enjoy the cost reduction, financial assistance as everyone else is. And with these policy changes, it's making our DACA recipients ineligible. They just became eligible last November. And so, starting 2025, have been able to enroll in ACA coverage and have been. And that could mean that an estimated 13,000 DACA recipients would then lose their eligibility for coverage. There's changes to refugee and humanitarian classification of individuals who are currently able to enroll in ACA coverage. They would lose certain classifications of refugees would lose their ability to enroll in an ACA marketplace plan. It removes gender affirming care as an essential benefit. It decreases basically what plans will pay for and increases out-of-pocket costs. And marketplaces can terminate or deny future enrollment to people with past due premiums. So that's a lot. Those are a lot of barriers to coverage that are coming out of these policy changes should they pass. And Medicare is also not off the table of health programs that would be impacted. New Jersey has 1.7 million Medicare enrollees. The provisions in these the budget bills that we're seeing would significantly limit Medicare eligibility for lawfully present immigrants, as we've seen with the ACA coverage as well. The bill is so big, this bill is so big that it actually triggers cuts to Medicare. And those triggered cuts would affect enrollees' doctors, And so, you know how hard it is for people to find doctors, and this would impact that. There are also administrative changes that would weaken Medicare's power to negotiate better drug prices. And so we've probably all heard about the changes in Medicare price negotiations that were Medicare enrollees were going to start to finally see those prices in the coming year, 2026. Now there will be delays in implementation of certain of those initial drugs negotiated. And so for New Jersey, the lower negotiated prices on certain drugs will be delayed, potentially causing half of Medicare seniors in the state to pay more for their prescription drugs. And so we've heard of the healthcare programs, Medicaid, Medicare, ACA, and of course, our hospitals and facilities, our federally qualified health centers and hospitals are going to be impacted by these cuts should they pass. In our state, we have 23 FQHCs, as we call it, with 138 sites. They serve over 600 residents. 81% of our federally qualified health center patients are on Medicaid or uninsured. 18%, that's 1 in 6 Medicaid patients rely on FQHCs. And over 30% or 100,000 are Medicaid expansion adults. So this is going to be crucially and detrimentally will detrimentally impact our health centers. It will be impacting our hospitals. It's estimated that cuts will be at least 300 million in federal funding to our New Jersey hospitals, capping our the Medicaid reimbursement through provider taxes at $3.4 billion. And we are, of course, expecting an increase in charity care cases. It's just, we had a briefing this afternoon and heard that there's changes to the Senate is proposing changes to federal funding to hospitals who see undocumented individuals in their emergency rooms. And because of that, the federal funding it looks like will be lowered because those hospitals are seeing undocumented individuals. So there's so many things that are coming out bit by bit from these bills in these budget bills in the Senate and in the House in Washington that we really need to pay attention to. And so it's just impacting every corner of our health system. And so with all of that, I would like to now pause a minute and just hear a professional story on these impacts. And I want to hear from Sobeda thanks, Mumtahina. Sobeda Santana Joseph, the executive director of the Valley Hospital, the Valley Mount Sinai Comprehensive Cancer Center.
Thank you so very much, Alora, for the opportunity and kind introduction this evening. I'm just going to take a moment to share my screen for a second. And I think I did it. Let me know. Am I good to go?
Yep.
Yep.
All right,
You're
perfect.
good.
So, as shared by Laura, I am a registered nurse by background and have the privilege of serving in several different roles at Valley for the last 16 years. But I found a passion in oncology for more than 20 years ago, and that energy works and continues to drive the work that I do today as I wear hats for the American Cancer Society and ACS CAN. However, I would be remiss if I didn't share with you that my greatest work has been as caregiver and advocate for my mother who is deceased of lung cancer in May of 2024, and my brother deceased of heart disease just 2 weeks ago. But Janelle and others are with us today, and that's why we need to fight and do this work. So, the Valley Hospital was recently located to Paramus, New Jersey, in Bergen County. It now resides in a 40-plus acre cancer campus. So the cancer center where I'm currently seated right now is directly across from this beautiful edifice. And I appreciate the opportunity to address the elephant in the room about the potential impact that these Medicare cuts can impact how our healthcare facilities, not just in Bergen County, but across the state of New Jersey. And though Bergen County is known for its high median household income and insured payer mix that everyone buys for, there are pockets of patients that are underinsured and uninsured that are our social responsibility. And we cannot and must not forget about them or leave them behind. So that being said, let's take a closer look at Valley. So we're a fully accredited acute care hospital that's not for profit in Bergen County. We serve over 440,000 people in over 32 towns. The Bergen County has 69 towns, so it's a little bit under half of Bergen County. It was this new hospital, formerly located in Ridgewood, opened a little bit over a year ago. In 2024, we saw a little bit under 60,000 admissions, 79, a little bit under, or a little bit over 78,000 emergency room visits, a little bit shy of 4,000 babies born. Can you imagine how many Medicaid individuals were affected or were impacted? Valley, as a non-for-profit organization, is committed to provide care to all those that come through the door, regardless of their ability to pay. So let's pivot towards the cancer center. We provide a complement of comprehensive clinical services to our patients. That involves early detection, infusion, which Janelle referenced to, chemotherapy, immunotherapy, surgery, radiation oncology, navigation, financial advocates, social worker, clinical trials, genetics. All of these services are available to patients, but they need to be covered. Medicaid cuts affect our patients. If we took a look at our cancer registry data from 2023, which was the last completed year available right now, we treated over 2,100 cancer cases, of which 48 of those patients had Medicaid as their primary insurance. We're not talking about those that also had charity care. How are we doing now? That number is much higher. How do I know? Because earlier this year, Q1, Q2 of 2025, we had a massive influx of newly diagnosed cancer patients that were admitted through the emergency room, initiated on cancer therapy de novo across the street with Medicaid as their primary insurance. What a source of anxiety for the team across the street, the team here at the Cancer Center, the families and their patients, to get them, one, on treatment as inpatients, and then to secure the continuity of care as they were getting discharged, for us to be able to receive them on an ambulatory basis. The blessing was that for many of them, we were able to accept their product, right? So a lot of them had, insurance that we can take, but we don't par with all of the Medicaid products that are available, right? So some of them we had to transfer to other cancer centers within the region. We have a social responsibility to advocate for access to healthcare to all, not to some. There is a stigma that Bergen County residents have money, that Bergen County residents are insured. And that may be true, but it's not true for all. So I think that this webinar is the beginning of an important conversation. And yes, facilities and organizations like federally funded healthcare centers and organizations like Valley stand to lose if we have funding cuts to Medicare and Medicaid, but patients, their families, and the community stands to lose more when there is no access to screening, to care, and we start seeing patients show up with advanced cancer diagnoses, and we have to care for them in a more advanced setting, and they are within our homes, which are the four walls of our organizations at a more lengthier time because we didn't speak up at a time like this. Thank you so much for the opportunity to be a part of this conversation, and we have to continue to fight.
Thank you. Thank you so much. That is sobering. And just first of all of the patients that you help, and just the idea that these policy choices could really impact those folks in time and an hour when they can least afford to have anything prevent them from getting connected to the care and treatment that they need. It's inhumane, it's immoral. But I thank you for sharing that. Let me continue on with our next focus. I mean, I know most of this we're talking about cuts to healthcare, but we really need to at least mention the cuts to education and our schools that are coming in these proposed cuts, should they be passed. Just kind of to give you a picture, New Jersey schools received a $1.2 billion in federal funding for K through 12. A significant portion of that goes to Title I, like $460 million, and IDEA $430 million, as student services $310 million, and that's like Head Start and other programs like that. And more than 4 in 10 students are low income, and they rely on Title I funding, and almost 2 in 10 students have special needs and rely on Individuals with Disabilities Education Act funding. So that's the IDEA. Also, this impacted, I should say, our school-based Medicaid services. So that's like for mental health and for various therapeutic programs as well. So these cuts are not only affecting healthcare, they're affecting our schools as well and our students. They're also affecting those who receive our SNAP benefits, our Supplemental Nutrition Assistance Program benefits. In our state, we have over 800,000 people across 400,000 households who receive SNAP benefits. Almost half of them are children. Nearly 1 in 3 are individuals with a disability, and 1 in 5 are over the age of 60. So the impact of the proposed cuts to the state would require New Jersey to cover more of the SNAP benefits. So in the House budget proposed bill, it's proposing 5% of SNAP assistance. I believe in the Senate bill, that's increased, I think, to 10%, but I know that it's increased to more. And this would cost, if it's, just taking the House 5%, it would cost New Jersey $100 million per year. So this increases the share of SNAP administrative costs. Currently it's 50%. It would go up to 75% if the House bill were to pass. It would be a different share if the Senate were to pass. And it would require the state and counties to spend another $100 million each year to administer that program. So this is really impacting and detrimentally, I should say, affecting all of our, so many of our services that are lower income and working class residents use and rely on. So I feel, this has been a lot to take in and digest, I know. And I hear you even, through the webinar waves. It is sobering, as I mentioned. It is disheartening. It is alarming. It's maddening, really. But it's not over. These cuts have not come to pass yet because the proposed bills have not been passed yet out of Congress, and so there's still time. And for those who might need just a little refresher on what the U.S. budget reconciliation process is, it's really a way that Congress is able to pass a bill, legislation faster and with fewer votes. Usually the Senate would need 60 votes to approve a big bill, but using the budget reconciliation process, they only need 51 votes. And if you are using this process, filibusters, ways in which to slow the vote down, are not permitted. And there are rules to this. It's a budget reconciliation has to follow certain rules. The policies that are passed through budget reconciliation have to follow certain rules. So it has to affect spending or revenue, the federal debt limit, and it has to follow certain and strict rules under what's called the Byrd Rule. And so this process, the length of this process really depends on a few things that we can't necessarily control, but it depends on the agreement between the House and the Senate, agreement within the House and the Senate, agreement within the parties within the House and Senate. It also depends on the level and amount of opposition that the members of Congress receive, and so many other issues also. So just to kind of show you where we are in this, if we were to break this down into 5 steps, we've gone through the first step, which is a budget resolution was introduced. The budget resolution is like a framework, the big picture of what the what they would like to, the spending amounts the administration or Congress would like to see, the top level, the frameworks of that would be, but it doesn't have like the details. And so after that was introduced, then that needs to get passed. The framework needs to be agreed upon. And then we need to, or Congress needs to put some details to it. So if you're saying you want to cut $900 billion from healthcare, then during the bill writing stage, you have to actually put where are those cuts coming from. And so now, as we've seen where these cuts are coming from, and they're coming from Medicaid, they're coming from Medicare, they're coming from the ACA, marketplace plans. And so then those details need to be passed by the House and also the Senate. And so we're kind of in this step 3 phase where the House has passed its version of the detailed bill, and the Senate is working on its version of the detailed bill. And so the Senate now has to the Senate now has started to distribute what its details are. And so that's one of the, that's what was released overnight. And so we're just now getting into trying to see what all are the details in the Senate bill. And then they'll go back and forth to try to come to some agreement. And ultimately, both sides will have to agree on one bill and pass that bill out of both sides. And then that bill goes to the president to be signed into law. The deadline, that initial deadline that the Senate had in mind was working towards July 4th. That's coming up pretty close. I don't know if they're going to meet it or not, but again, each of these stages and steps depends how fast these stages and steps go, depends on the amount of opposition that they receive and pressure that they receive. So I now will turn this over to Liz Glenn. She is our Director of Organizing at Citizen Action, and she'll go through what can we do. Liz?
Great. Thanks, Laura. So as Laura was just explaining, what's been going on is this bill went through the House, and then it is going through which is what I think it just finished going through the Senate. Is that right, Laura?
The bill, well, it came out of that one committee. The committee,
Came out of one committee.
One of the
Okay.
committees. Yeah. So it's not finished going through
Yes.
the whole
It's not
Senate.
finished.
Yeah.
So in our state here in New Jersey, we have 2 senators, Cory Booker and Andy Kim, and we know they're already fighting on this, and they are with us on opposing these massive cuts. So it's always good. You can still contact those senators and thank them for fighting on these, fighting against the cuts, but we don't really need to give them pressure on this per se. But the biggest thing to do is make sure we are pressuring the House representatives in our state who did vote yes already. So they voted yes. Actually, Representative Tom Keene Jr. voted yes already at a committee, and then he voted it yes. Well, they all voted yes on a procedural vote. Keene voted at a committee, and then all three of them voted it yes on the House floor. All of our Democratic representatives in the House, they all voted no. So who we need to pressure are these House representatives, because as Laura was explaining, once the bill passes through the Senate, it will have to go back to the House because they have to resolve their differences. So they will have to vote one more time. So we still have an opportunity to pressure them between now and when they're going to vote again, and make it very loud and clear that we oppose these cuts. And so we will on the next slide, I have an e-action that folks can take if they want to contact them. The downside is that really the most effective people to contact these representatives are their constituents. So Congressional District 7, which is represented by Tom Keene Jr., it's like a big swath of central New Jersey. It's a section of Union, it's Somerset, Hunterdon, all Hunterdon, all of Warren, a section of Sussex, a section of Morris counties. But it's best if you live in that district to contact him. Representative Chris Smith is Congressional District 4. It's on the Jersey Shore, so it's Monmouth and Ocean counties. And then Representative Van Drew is CD2, which is also the southern section of Ocean County. It's Atlantic County. It's Cape May County, and then it's Gloucester, and I know I'm gonna mess up all these other counties, but it's like a large swath of the South. So you'll be able to, when you click to take action, it will tell you who your rep is. And unfortunately, you'll only be able to contact those reps if you represent them. But the thing that everyone can definitely do is help to educate our own networks, and make sure folks know what is going on. And then these changes on the federal level, as Laura was explaining, it's going to affect us on the state level. So I also will say the upcoming election, the state election in New Jersey, our election for the governor and for the assembly, is really important, because our state leaders are going to have to make some very critical decisions about how are they going to fund healthcare. What are we going to do on the state level to ensure we A, continue to bring in enough revenue, and then B, prioritize funding what we need to prioritize. They will have to make ultimate decisions about any kind of changes or cuts that we may need to be done on the state level, because if we lose, if this goes through and we lose a good chunk of our federal funds. So it is really important to see where our candidates stand when it comes to healthcare and healthcare cuts, and what is their plan to manage this on the state level and to help ensure that the most number of people can continue to have the care that they need. The third big thing that'd be really helpful is collecting stories. So if anyone has stories, we will also be collecting those stories. If we want to go to the next slide, I think there's for these, so tell your stories. So if you have a story, if you're in Congressional District 2, Congressional District 4, or Congressional District 7, you will have a story, personal story about how you'd be impacted or know someone who'd be impacted, please send them our way. These personal stories are really key. We use them for our advocacy work. We send those stories to the representatives, and make sure we uplift those voices. So if you do have a story, please share them. They're really powerful. If you want to go to the next slide. If you're not already signed up to be part of our email list and to be able to take your e-actions and know what's going on, please sign up. There's a QR code. You can actually just use your phone on your screen. You should be able to use the QR code if you want to join. Anyone who registered for this webinar should also be connected with us so we can follow up and make sure that you have more information about how to fight with us. And we've been fighting, just to be clear, we've been fighting really hard on this. We've been to all three of these congressional offices. We have met with the staff of all of these congressional reps here in New Jersey. We have met with them, we've called them, we've emailed them, we've shown up in their offices, we have rallied outside their offices, and we've continued to kind of amplify the voices of folks who are being personally impacted. But as Laura said, we're going to continue fighting, and we'll fight for this to the very end. And then we will also not only fight this on the very end, the federal level, but we'll be part of this fight on what this looks like on the state level. If you want to go on to the next slide. So again, just to reiterate, we want folks to call their congressional offices. And you can also, other things, folks can write letters to the editor. If any folks are welcome to contact me, I'll put my email address. If anyone wants to write a letter to the editor, I'm happy to help folks get a letter published in their local paper. We have the phone numbers for these reps right here on this slide. So you're welcome to write down these phone numbers if you want to call yourself personally. Anyone's welcome to call. Some of these offices, though, don't record the call unless you're a constituent, just to warn you. Right, and then we've also been collecting postcards. We've collected like thousands of postcards that we've delivered to these offices. If anyone wants to continue to help to collect postcards from constituents, also my email's in the chat. You're welcome to contact me if you want to coordinate collecting more postcards. You go to the next slide. Laura, where's the slide with the e-action? Is that the next? Is this QR code the e-action, I guess, Laura?
Yes, this is the e-action.
Okay, I didn't realize that. Sorry. So if you need to do the e-action, you can do this QR code. And then I will I can't do it right now because I'm on sharing my screen, but I will put the link in the chat also for this e-action. So if anyone still wants to take action to contact the reps. And then we can, Montina, I don't know if you're able to put these phone numbers right in the chat also for folks. We'll also send it out to folks via email so that you have all the ways you can contact them in your when we send a follow-up email. All right, Laura, you want to go to the next slide?
Yep.
All right, so this is all of our contact information and who we are. I don't know if you're able to can we do sharing this whole screen? Because I think it's only split screen right now. I don't know if Montina, you're able to make it so people can see our emails. So it takes up the whole screen.
Yep, the emails are on screen.
Okay, on my screen it shows it like a split screen, so it's not showing what's being shared like as the whole screen.
You know
So
what?
I don't know, folks.
We'll pull it up after the Q&A.
Okay.
We'll pull up the emails. Yeah.
We'll put this up bigger so if folks want to email. Again, I put my email right on the chat, so folks are welcome to contact me directly if they have questions about how to take action. And then actually, Laura, I'll put yours right here also. But Laura's more of the policy person. So if you have questions for Laura. You go to the next slide. I think we just do Q&A right now, right? Okay, so I know we're running out of time here, but we'll try to fit in some quick questions. I think some folks already had some questions in the Q&A box. If folks have questions, please put them in the Q&A box, or you can put them in the chat box. So I'm just going to go right into the first question here and see who wants to take the question. So the first question is, how will this big bad bill impact healthcare costs for employees with private health insurance provided by their employers?
So this big bag bill is really going to it's impacting everyone. So if you don't think that it will impact you because you're not in Medicaid, because you're not in an ACA plan or not on Medicare, we would be wrong in that assumption. If you go think back to the stat that I gave as an example, for seniors who are 4 and 7 are enrolled in Medicaid, who are in nursing homes. If those 4 and 7 have their funding reduced, that facility, the cost of healthcare would not have changed. That facility will have to make up for the reduced level of funding, and the folks who are not in Medicaid, who are in that facility, it's certainly possible that the cost of services would have to be increased for the others. And so, even though there are specific cuts to these specific programs, it's really going to impact pretty much every corner of our healthcare system.
Great, thanks, Laura. Someone had a quick follow-up, is that they're wondering, is this going to make our premiums go up?
This is going to make premiums go up, yes.
Okay. Next question, is there any change proposed in the parity that mental health care coverage has gained to physical care?
Yeah, so this is one of the areas that we're still kind of digging through the information out of the new Senate bill, and the Senate detail. It's not been 24 hours yet that it's been released. So we're still trying to ascertain what all is going to be impacted, what the level of cuts are. The bill has not even been scored by the budget office, the Congressional Budget Office yet. So there are totals and amounts that we still don't know for what the Senate Health Committee has put forward. So we're still trying to figure that out, I guess, is the long way of saying. And so we just have to kind of stay tuned. I will tell you, just in general on mental health, there has already, we've heard the commissioner of DHS report when she gave her budget testimony that there has already been federal cuts to grants that the state has seen, and that have impacted mental health services already, that have impacted substance abuse programs, and so, or I should say, mental health programs and substance abuse programs. So there are certainly mental health is certainly impacted by the provisions of these bills and these cuts.
Great. Did anyone else here want to share about any of those topics that Laura just shared? Anyone else need to chime in? No. Okay. Next one is, do the cuts include Medicare savings programs? It says QMB, SLB.
It's because it's the cuts, because the funding is being reduced to the kind of entire program, and these changes are impacting the entire program. It's, if you think of it, if you're getting less to fund an entire program, again, sorry to kind of to quote the commissioner in her budget talks, but there are only like 3 levers that she has to pull with reduced funding. One is to look at to look at eligibility, who's eligible for coverage. Another is to look at service offerings and services and programs. And the other is provider reimbursement. So reduced funding means the state would have to look at those levers and make changes to those buckets.
Those are all the questions that I have here. I guess one final question from anyone that you can jot it in the chat. You can put it into the Q&A. All right. Well, I think that then we'll wrap up, Laura. I know that we already went a little over, and I appreciate everyone just being able to take the time to explain everything. Like I said, we put our emails here in the chat, and we will also send a follow-up email that has more of our contact information. It shares the slides. I know it takes a little time to like totally absorb and understand all this information. So we're available if folks want to reach out to Laura or I if they have additional questions. We're happy to answer them. And then Quentin, did you something you want to add here?
Hello, can you hear me?
Yep.
Okay. No, I just wanted to say thank you for including us. The American Cancer Society Cancer Action Network, uh, we we are trying our absolute best to work with Congressman Van Drew, Kane, and Congressman Smith to discuss the meaning of their votes when it comes to this bill, because we know it's going to come back to the House. So I can't echo it enough. Whatever you can do, please go out there and try to advocate to convince these lawmakers the impact of Medicaid. And when it comes to cancer, access to health coverage is one of the greatest predictors of whether someone survives their cancer. And if we're cutting upwards of about 800 billion from Medicaid, people living with cancer could have their care interrupted or stopped completely. And you've heard the stories tonight from our volunteers, but others would lose access to regular cancer screenings and prevention, and we can't afford that. So, if I know we won't change their votes tomorrow, but if you do something today, it can contribute to that effort. So let's work together and get it done. Thank you to Laura and Liz for having us. We look forward to the continued partnership because the fight doesn't end today.
Yeah.
Thank you
you.
so much.
Thanks.
And I just wanted to again thank our co-sponsors, American Cancer Society Cancer Action Network, and the New Jersey Black Empowerment Coalition, and a special thank you to our amazing panelists, Janelle and Savita. I have learned from you, and I just thank you for sharing your perspectives. It's so important because so much of this is about talking about numbers and statistics, and being able to actually hear from our frontline healthcare folks, our actual patient, what and how much these cuts would critically impact them, is so important and so impactful. So I thank you so much. I want to thank Liz and Mumtahina in the background there, and all of our staff. But I cannot say it better than Quentin said. And we really it is not, if you don't take anything from this, take that it is not too late. The window is closing, but it is not too late for you to get engaged. I hope this affected you. I hope you learned. I hope this was informative for all of you who are watching. I hope this, maybe even made you a little upset. Upset enough to go out and make sure that you call on your congressional representatives to vote no. Vote no to any cuts. We want to see no cuts in healthcare, in education, in SNAP. And just know that we all have to work together on this, and we need your voices. We need your presence. And we need you to join us in this fight because we cannot alone do this. And so thank you so much. Yep.
And Laura, Jane, did you want to say a final thing?
Yeah,
Again, we really appreciate your sponsorship.
Great. I just want to say thank you, Liz and Laura, and all the folks who showed up today. This is a very, very critical time in our, the state of New Jersey. Facts matters and action matters. And this is the time for us to stand up rather than sit down and talk about it later. And hopefully this video will be shared, and I will try to share it through my networks. And if anybody else can share, it was very informative. The testimonies matters. It matters that New Jerseyans are well informed about what's happening, to their healthcare. We're talking about children's SNAP being cut, programs in the schools being cut. Those are very important things. I was on a campaign trail and people talk about affordability and not having food on the table. But this information is very critical, and we should share it, and people should hear it, and they should take action. And now is the time for boots on the ground, and we need action. And this is action time prior to the bill being passed. So thank you.
Great.
Yeah.
Yep, and we promise to
hope
keep
you got
people
fired up
informed.
and ready to go, right, Liz?
So, yes.
Yes, and again, we our aim is to keep people informed, so we will keep people informed as as things move along. But we rely on all you to take action with us.
We will. Thank you.
All right. Well, I think that concludes everything, right, Laura? So thank you all so much for joining us this evening.
Thank you.
All right.